My name is Derryck Smith. I'm a psychiatrist in Vancouver. I've been a past board member and active supporter of Dying with Dignity Canada. The reason why I'm supportive of MAID for psychiatric illness is that psychiatric illness is, after all, a disorder of the human brain. I don't like the idea that we have medical illnesses on one side and psychiatric illnesses. I see these as all conditions of being a human being, and in this case of having a brain. For example, dementia, is that a psychiatric illness or a medical illness? What about Parkinson's? Is that psychiatric or medical? I think the truth of the matter is they are all medical conditions. So medical assistance in dying is available for people with other conditions, and it certainly should be for psychiatric disorders. We're not asking for any special consideration for people with psychiatric illness, simply that if they meet all the criteria that are in the legislation, then like everybody else, they should be eligible. MAID is never something that you rush into. I don't know anyone who feels down today and gets MAID tomorrow. I mean, that's simply not the way things work. There's always a careful assessment period. The people who are providing MAID, are trained professionals, and they are very cautious in interpreting these rules. My experience with people who are assessors and providers, they are extraordinarily careful. We really don't know what the assessment's going to be like for persons with psychiatric illness, because the rules are going to be, I think, pretty explicit. I think it's probably going to require an assessment from a psychiatrist, which is again unique because we don't demand special expertise for people with other conditions. For example, if you are applying for assisted dying with cancer, we don't insist that one of the assessors be a cancer specialist. But I think because of all the nervousness around psychiatric illness, that we're probably going to have a specialized psychiatrist as one of the assessors. The cases that I've seen, these people have had psychiatric illness over 10 to 20 years. What I've been looking for is have they made reasonable attempts to have their condition treated? Now, have they seen psychiatrists? Have they tried medication? Have they tried psychotherapy? Have they been hospitalized? How long has this been going on for? And the other thing is there an obvious treatment that might benefit them? Because if there is a treatment that looks, for example, if they've never had treatment with an antidepressant medication, and the treatment and the diagnosis is depression, then I'm likely to suggest to them that they probably would be better off attempting to treat their depression than looking for assisted death. So after all, we're there to help people. We're to help patients. That's what doctors are all about. So it's not a rubber stamp process. It's not assisted dying on demand. It's a careful assessment that people have made a reasonable attempt to get treatment over the course of the illness that they've had.